So what are some of the biggest changes that people are going to see in Dubuque County as they begin to sign up for coverage through HealthCare.gov?
I think the biggest changes that the patients are going to be more concerned with is the increase in premiums. The other major thing that is happening or has happened is that United Healthcare no longer offers their plan in the state of Iowa. So if a patient did have United Healthcare, they will need to select a different health insurer for their coverage. And in Dubuque County, that would either be Aetna or Medica.
Okay. And what are people going to see on average when it comes to premiums in terms of increases?
They will, let's see, I want to make sure I get that right. The average increase in 2017 for Aetna would be 22% approximately, and for Medica, their increase in their premium would be 19%.
Okay. And what are some of the reasons, or I guess maybe one of the key reasons as to why we're seeing dwindling choices, insurers pulling out of participating in the federal exchange?
I think that as we know, United Healthcare is dropping out, and one of the factors for that is that many of the patients that accessed care through these insurers required to use a lot of services, therefore increasing the cost, and the healthier population may have elected not to obtain coverage and pay the penalty, where they didn't access services as often as certain other groups of patients who may have required more. Therefore, it resulted in that the insurers were not, they weren't expecting that, and therefore that the costs were higher with the insurers.
Okay. And then lastly, what are some key things people should, I don't know, consider, keep in mind as they go about signing up for coverage?
Some of the key things, I think, is that all the subscribers should evaluate how their coverage was from 2016, and they, if this open enrollment period is an opportunity for them to change to a different provider if they feel that their provider maybe didn't, maybe their physician wasn't in network with the insurance that they have, and they should take that into consideration. Also, if they had United Healthcare, there is no choice, and they will need to select a different provider. Again, in Dubuque County, it would either be Aetna or Medica.